Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. You know, avoiding COVID-19 is top of mind for most of us, but it's especially critical for organ transplant recipients. They're at a higher risk because they take immunosuppression drugs that keep their body from rejecting their transplant. But a side effect of those drugs is a weakened immune system. That's where telemedicine and other advances in home-based care can help patients and their caregivers stay healthy during this pandemic. Now, here with more on this topic is leading transplant surgeon Dr. Adam Bingaman from Methodist Hospital, Specialty in Transplant, along with Peter Maag. Peter Maag is CEO of CareDx. Welcome to Health Professional Radio, both Dr. Bingaman and Peter Maag.
Good morning. Thank you, Neil, for having us.
Doctor, what are some of the risks that are associated with organ transplants, especially during this COVID-19 pandemic?
Sure. Well, like you outlined, a transplant is a real gift of life, but of course patients have to take those medicines that keep the immune system down to protect the organ against rejection. Mm-hmm. And so while patients have to take those medicines, they've got to be very cautious during this pandemic. And of course, the cold and flu season is coming up. And so really our recommendations are to stay safe, stay vigilant. That means social distancing, wearing masks, making certain that you're keeping up with your doctor visits, if you can, from home via telehealth options, and making certain that you're keeping up with your blood drawing to be making certain that the function of the organ is being monitored carefully.
Is there anything that you'd like to add for transplant patients that they should know, especially now, other than what you just pointed out?
Well, you know, transplant patients really need to involve caregivers. You know, a transplant is a family affair, so please make certain that you've got a caregiver that's helping you as you navigate through this difficult time.
Peter, Dr. Bingaman spoke of telemedicine technology. What technology and home health options do patients have, especially now during this COVID-19 pandemic where telemedicine has exploded?
Well, there are really two important approaches. One is home-based phlebotomy or home-based blood draws. So let's make sure that you have the option to actually get your lab work done. And we offer a solution where somebody comes to your home and gets the blood drawn done in the convenient location of the home. And then secondly, we have developed an iPhone app called Allocare, which allows you to monitor the health of the organ and keep up with your medication. So these two things, one is home-based blood draws and the other is an iPhone app, help you to navigate in these very special times now.
Doctor, recovery is just as important as the treatment. Let's get in depth about the importance of a successful recovery and how to achieve that.
Right. Well, recovering from a transplant really is something that's so important. People wait for so long for these organs, for these life-saving organs, and so we want folks to live a normal life after a transplant. But it is important, again, during this time that you've got to be able to keep up with your doctor visits. Take care of other medical problems you may have, like diabetes, like high blood pressure, like heart disease. Make certain that you're partnering with your doctors to be getting the flu shot. Make certain that your caregivers are in the home are staying safe. And again, making certain that with the holidays coming up, that everybody is being very vigilant, socially distancing, wearing masks, but again, partnering with your transplant center as you recover.
Recovery is going to look a lot different for those who have been in recovery before this pandemic. When it comes to, say, the mental health or the mental support that you have normally been getting during your recovery, is that going to be something that telemedicine can help to continue?
Yeah, for sure. I would say, so one of the issues with telehealth, and it's so important, it's a wonderful technology, is again, you utilize a caregiver to help you. We found some people are afraid, they're nervous, they're not really sure how to use this technology, but it is very simple, and it's such an important aspect of staying well during this time, so you can stay home, but continue to get the care that you need.
Peter, when it comes to caregivers, talk about some of the key factors in being a caregiver, some of the things that they should know just to be a caregiver in general, but especially when it comes to dealing with someone who's in recovery, who's had a transplant.
It's communicate. Make sure that you continue to communicate transplant recipient with the healthcare professionals and continue to monitor the health and the status of the transplant recipient. So, we're trying to support you in this communication with Allocare with a simple iPhone cap, but it's very important to continue to communicate.
the mental health of the caregiver is also key.
Oh, yes. It's so important that we continue to care for caregivers because at these very special times, there's more pressures and more activities coming to this caregiver. So make sure that they are getting a broader support system. Dr. Bingaman mentioned that it is a family affair. And this is maybe sometimes the caregiver needs a caregiver. So make sure that you continue to stay healthy as well as being a primary caregiver for a transplant recipient.
Dr. Bingaman, sometimes the conversation about what's going on with a patient can be a hard one. How does that conversation get started with a caregiver when they simply want to know more or be a better caregiver?
That's right. Well, my recommendation is that this really is a partnership. You know, to have a transplant, which is a complicated field, be successful, it really takes teamwork. And so we really strongly recommend open communication with the transplant center, with an extended network of caregivers, making certain that we're keeping in communication with each other. It's very difficult to be alone in any times, but especially these times. So utilize friends, family, neighbors, faith group members, and always involve your transplant team in all of this communication.
Is there anything that you'd like to say to your fellow physicians when it comes to dealing with transplant patients? Oftentimes, a procedure is a procedure. Is there anything that you'd like to say to your colleagues as far as sensitivity and being a little bit more compassionate sometimes with patients?
Right. It's an excellent point. You know, my advice is make certain that you're being certain that your patients understand that telehealth options are very simple. Some of the things, you know, fear is what has to be overcome in these times, and education helps to overcome that fear. And so my recommendation is for doctors and transplant centers to make certain that you're spending extra time with patients, comforting them that it is safe and it is simple for them to continue to care for themselves and use these very easy technology applications to remain safe and healthy.
Adam, I'd like you to give us a website where we can learn more about Methodist Hospital, especially in transplant. And Peter, a website from you where we can learn more about CareDx.
Thank you. So Methodist Hospital Specialty in Transplant is a leading provider of transplants in San Antonio, and you can visit us at sahealth.com.
Great.
And it's CareDx.com RemoTraC or CareDx.com Allocare for lots of more information to maybe build a huge transplant community with Allocare. So thank you so much for having us today.
I appreciate both of you joining us here on Health Professional Radio. It's been a pleasure.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.